The last question. Which of the following is correct? You have to tell the correct statement regarding the cataract surgery. Now, though of late they are not asking the questions on the cataract. Every time they are asking the questions on the glaucoma. But I thought that let us try to keep one question on the cataract surgery also. Maybe this time they will be stimulated to ask about the cataract also. Yes. So, which of the following is the correct statement? Let us see true and false करके देखते हैं. Number 1, placement of the IOL should be in the posterior chamber in the patients with the juvenile rheumatoid arthritis and iridocyclitis. Is it true or false? Should you place the IOL in cases of juvenile rheumatoid arthritis? Yes or no? See, in cases of juvenile rheumatoid arthritis, IOLs are contraindicated. IOLs are contraindicated. So, of course, this statement is false. Crazy Cricket, where are you? Are you able to follow this? So, placement of the IOLs are contraindicated in cases of juvenile rheumatoid arthritis. So, it's false. Looking at option number 2. Ideally, uveitis should be quiet for 3 to 6 months prior to the elective surgery. So, should you operate at once if the patient is having uveitis, or should you wait? Tell me the B option. B option is true or false? Tell me. A is false. Exactly. A is false because GRA में IOLs are contraindicated. What about the B option? IOL नहीं देते हैं. So obviously it should not be. तो इसलिए posterior chamber and anterior chamber की तो बात ही नहीं है. We do not give actually. So it's a false statement. So yes, we have to wait. So they are saying that we have to wait for 3 to 6 months prior to the elective surgery. So this is a true statement. Okay. So this is your true statement. Let us see about the statement number C. C का देखते हैं true है या false है. This was a true. Patients with the Fuchs heterochromic iridocyclitis have a poorer prognosis. What do you think? If I have a patient of Fuchs heterochromic iridocyclitis, will I have a poorer prognosis? Now, if you remember, what were the options of Fuchs heterochromic iridocyclitis? They were having unilateral, stellate KPs, iris atrophy, and there is no posterior synechiae. So I do not have even the posterior synechiae. So there is no, evidence. There is no justification that this will have a poorer prognosis. Rather, I do not have the synechiae. So this statement is true or false? You guys are telling me about B option or C option? C का बताओ. C option is false. It does not have a poorer prognosis. Rather, it's a limited one. One side है, unilateral है. It is unilateral. We have a mild anterior uveitis and there is no synechiae. So there is no reason for which we can say that it is a poorer prognosis. This is false. Then coming to the option number D, the risk of complications increased in the patients with pars planitis. So tell me about statement number D. Is it true or false? Do you get more complications if the patient is having pars planitis? Pars planitis means intermediate. Now, if I am doing the cataract surgery, I have to do the cataract surgery in the anterior side. So, the risk of complications will not be increased. So, this is also false. So, they are asking you the correct statement. That will be B. Uveitis should be quiet for about 3 to 6 months. Let it settle, inflammation subside, and then you can do the cataract surgery. So, these were the 10 important questions for your INI-CET, and I tried to include all the things which I felt that are important with respect to INI-CET, and more important that jokes apart, we do not know what exactly they are going to ask. But if you look at the pattern, how they are asking, how they are forming the question, how they are formulating the options, how you have to approach the systemic involvement hai, the image based questions hai. Then we have got this one, your KF ring, Wilson's disease, your abnormal pupillary reaction. So these are the important things that they are often asking, and more important than that, the clinical way in which they are asking, we try to do that. So I hope this session will definitely help you, and you will come up in flying colors in your future paper. So I'll see you again in the more live sessions. This is all for today. We have done the 10 most important questions. Thank you guys, and keep on studying and keep on sending the messages as you people send for the topics for the upcoming live sessions. This helps us more in giving you those things that you actually need, and we'll get to get more interacting with you. So thank you.